Hey everyone, what's up? This is Dr. Charlie. Quick video to share with you something that just popped in my head, an experience I just had with an individual who called. I think his name was Mike, and he was from somewhere in Tennessee. Either way, he had a strong southern accent, which was pretty interesting. But either way, thanks for calling, Mike. And he said, hey, Dr. Charlie, I was told via my MRI I have a pain deep in my butt cheek. Deep in my butt cheek, and it was right around here, all right? A little bit on the side of the hip, and then he also gets some tingles all the way down the leg into the shin on that right side, all right? And he said, hey, I got a shot for bursitis. It didn't work. Well, of course not, because bursa causes pain here. It doesn't cause pain here, and it doesn't cause tingles down the leg. That don't make no sense. I could have told you that wasn't going to work. And then he said, oh, and the MRI, after that didn't work, of course, because if that doesn't work, well, then it must mean you need an MRI, right? Rather than relying on like some good detective work and sound clinical reasoning. That's just what we do because we're lazy and we've lost the art of a good clinical exam and we don't take time to listen to people. Because if you would have listened to Mike and he said, hey, I've got pain here and I've got some pain at kind of here and I've got some tingles that go down the leg and I'm 66 years old and, it just kind of started. I wasn't running. I wasn't doing anything like that. By the way, he was told via his MRI that he had a high hamstring tendon problem. What is the likelihood in somebody who's 66 years old and not an athlete, meaning doesn't run, hasn't been running, hasn't really been active that much, that they all of a sudden develop some type of like irritation of their hamstring tendon and a hamstring tendinopathy or tendinosis or irritation in that area for no reason? Just sitting on their couch randomly, they develop a musculotendinous problem. Tendons transfer load from muscles to bones. And this is why you usually see hamstring tendon problems occur in people who are younger, who are stressing their hamstring tendon area, that musculotendinous junction, we call it, out by running, by jumping, by sprinting, things like that. Hamstring problems much more common in people who are, say, 20 to 40, active, usually runners, soccer players, things like that. A lot of quick, speed, plyometric type activities that are kind of straining or loading that area. But he's 66 and he's got pain here. Oh, by the way, the hamstring doesn't refer pain there. The bursa doesn't refer pain there. So if the hamstring doesn't refer pain there and the hamstring doesn't cause a tingle, it can't be a hamstring, right? If he has pain here, well, then it can't be a bursa problem. And by the way, bursa problems, hip bursitis problems, don't cause tingling down the leg. So what could it be, right? And I said, hey, man, look, the issue with your MRI is that they could take an MRI of lots of people your age, and you're probably going to have some hamstring stuff and or some other muscular stuff and or some hip joint stuff or back stuff. Lots of people are going to have these problems, and they're not going to feel any pain. So what happens is the MRI picks something up. Orthopedic doc doesn't know what they're doing. MRI picks something up. And then they just label you with that. They just go, bam, hamstring problem because the MRI says it. They don't have to think anymore. They're just treating the image, not treating you. All right? So what could explain pain here, bursitis pain, pain here in this area, and then some tingles all the way down the leg into the foot? Well, the thing that connects everything, sciatic nerve. Right? Not to mention, he's saying tingly, some funky feelings going all the way down his leg. And what do we know is the number one cause of sciatica? Think of the sciatic nerve as a garden hose, right? It's hot out here where we're at, so like you're gardening, right? And all of a sudden you're around the corner, you pull this hose out, you're watering the flowers. But then all of a sudden the flow of water stops. What are you looking for? You're looking for a kink in the hose. Right? And so where's the most common place where the sciatic nerve gets kinked? Yes, it could be in the piriformis. It could be maybe trapped down here. It could be trapped anywhere along its path. But usually the back, right? You have the spinal cord, and then you have nerves that exit. They come through holes in the spine called foramen, and that's a lot of times where things get pinched. So I said to him, hey, if this is a hamstring problem, or if this is a bursitis problem, and not what I think it is, then you know what? Let's try to figure this out. So what we're going to do is we're not going to move the bursa. We're not going to move the hamstring or contract it in any way or do anything like that. We're just going to move this switch up here, the back. And so we did this all via the phone, actually, really quick, all right? Couldn't see him, couldn't do anything like that. But I said, hey, go ahead and bend straight backwards for me. All right, so go ahead and bend straight backwards for me. Any pain or problems? He said, no. I said, okay, here's what you'll see. I knew that we were probably missing something. A lot of times, when people bend backwards, they will get reproduction of the symptoms going down the leg. So I started off with having him just bend straight backwards. Put your hands on your hips. I had him bend straight backwards and see if we could reproduce the bursitis pain or the butt pain or the leg kind of tingling, and we couldn't. Oftentimes you need to go further, and this is why a quick exam will miss it. So what I said is, okay, your symptoms are down your right leg. Go ahead and twist to the right. Good. And now bend straight back. All right, so twist to the right and bend straight back. Really closing down or kinking down on the joints on this side of the spine. And as he did that, he said, oh! I said, what happened? He said, shot of pain all the way down my leg. Now I got tingling going down into my shin. Right? And so I said, hey man, sorry that you went through getting a shot, needing an MRI, but it's your back. Now, what about your back? He's 66, so probably some type of a joint irritation, right? Disc problems. The probability of a disc problem in somebody who's 66 goes down. The probability of a what we call facet joint problem or joint problem in the spine goes up, right? The chance that there's an SI joint problem if he has symptoms, tingling, nerve problem, and or anything below the level of knee goes way down. So you're probably dealing with some facet joint problem. By the way, he said his tingling is in the shin. What nerve owns the real estate of the shin? The L5 nerve. And so we're talking an L4, L5 facet joint problem on his right side, irritating or sensitizing the L5 nerve. And so he's getting some sciatic nerve irritation. Sciatic nerve comes right around here, gives some branches right off. And it can cause deep buttock pain, all right? It can cause hip bursitis type pain. It can cause and explain the stuff that he gets all the way down into his shin, the tingling, all right? And so if you have some high hamstring diagnosis, because that's what they saw on the x-ray or the MRI, and you're, say, above 50 and you're not an athlete, and you don't even know why this even started, right? You don't have any explanation for it. It's not like you were overtraining or you went for an extra long run that day, right? And the symptoms are, yes, in your butt, but maybe they're out here, or maybe they're down a little further, or maybe they go all the way down your shin into your foot. That is not a hamstring problem. Hamstring problems refer locally. Hip bursitis problems stay local. Okay, so not a bursa problem because she's got this and this, or he had that, right? Not a hamstring problem because it doesn't cause pain, it doesn't cause tingling. So what could explain it all? Usually something upstream. If you have a kink upstream, if the kink is here, then it's going to impact the flow all the way down. And it could explain every symptom that he's describing. And it makes sense with his story. The problem is that the orthopedic physician did not listen to his story, right? So if you go to a slot machine at the casinos, by the way, never gone. Pretty crazy, right? But if you have an apple, 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 you win. At least that's what I think, right? I think that's how it works. You got to match things, right? If you have an apple, apple pear, you don't win. And so what happened is, yes, he got some pain here. So an apple for hamstring. But then you got pain here, pear, tingling pear. Doesn't make sense. All right. Could it be hip bursitis? Well, apple makes sense, got pain there, but now you got pain here. And you got tingling down the leg. Apple, pear, pear. Doesn't make sense. Right? Oh, something upstream could cause downstream effects. The back, right? This were a river flowing downstream or a garden hose, right? If you cause a little bit of a kink here or a jam here, and you have pain here and pain here, the back can explain all the downstream symptoms.
Apple, apple, apple.
Apple, 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 right? And not to mention, if you flick the switch in the back, this is how you can start to be smart and isolate things. If you flick the switch in the back, notice I didn't move this, I didn't do anything. I just said, hey, can you rotate? That'll be you. You rotate and bend backwards and kink down on that side for me. Ow! That's it. You got it. It's a spine problem. And this is why I'm so passionate about teaching people to diagnose their own cells. There's nothing special about what I just did. Yes, I have lots of knowledge and understanding of it, and I spend a lot of time studying that stuff. But at the end of the day, you can absolutely do this stuff. By the way, who knows their story better than you? Nobody. You. Who knows what they're feeling better than you? The answer is nobody. It's your pain experience. Who can move their body and sense what they're feeling as a result of those those inputs or those movements that they're doing to their body. Who can feel that better than you? Nobody. And so why don't you combine your story, what you know about your symptoms already, with the location of your symptoms. Based off location, we can get an idea of is it this or is it that? We just talked about that. And then a movement exam. If you do certain movements of your back, of your hip, of your leg, right? Then the chance that you can figure this out with a high probability, without needing MRI, without needing X-ray, is very, very good. Not to mention, that's all we need. That's all he needs. That's all he needed. But he was told to get an MRI because that's how other people make money. And they're just lazy. And so if that's you, and you feel like you're kind of getting some confusing results and or inputs or advice, could be this. Let's give you a shot and see. Sounds like a really bad idea. You can do it if you want. Could be this. Let's get an MRI and see what happens there too. MRIs can't really, determine the cause of symptoms. There's very little correlation between what is found on an image and the symptoms that people experience. So this guy, he shows a hamstring thing. I'm saying, hey man, look, I get that you show via your image that you have a high hamstring problem. But at the end of the day, it's not the cause of your symptoms. All right, it showed up. Just like a vacuum picks up every piece of dust. We got the cleaning lady coming here in a little bit. It's my mother-in-law, by the way. All right, she's gonna clean up all this dirt. All right, but it can't pick up the one piece of dust and say, hey, that's the thing that's causing your pain. It doesn't differentiate. It just picks up everything on the image, everything that's wrong, everything that's right. It's just a picture. And by the way, do you live in stillness and absence of motion all day? No, you live in motion. You're a living, breathing, moving human if you're watching this, or maybe you're an alien, right? But either way, at the end of the day, right, a lot of times these pain experiences occur when you're moving. He doesn't have pain when he's just sitting there. He has pain when he's moving. He doesn't have pain maybe when he's laying there. He has pain when he's moving. And yet, we take these still shots when people are maybe lying down when they don't have symptoms. And even if they do, right, why would somebody be laying there on the bed, on their belly, and the longer they lay there, they'd be saying, ow, my pain in my butt is getting worse if it was a hamstring problem. He's not contracting his hamstring. But he is laying in an extended position, probably arching his back a little bit, right? And so you've got to find someone who's a detective. If you're getting mixed results and you're looking for not only, an answer as to what could be the most likely source of your symptoms, but you're also looking for a natural solution, all right? It doesn't involve you relying on other people. Then there's lots of things you could do. But first things first, check out my Better Than an MRI DIY diagnostic guide. I lay out my entire diagnostic algorithm. I continue to iterate it and try to make it better. But at the end of the day, again, you can absolutely, if you're watching this and you have some sort of back, butt, hip, hamstring, whatever, pain in and about that area, you can solve this. You can figure out the most likely source, the most probable source with a high degree of certainty. And you can solve it too, naturally, using movement as medicine in most cases. All right? So check out that DIY diagnostic guide. Work through it. Put your thoughts below in the comments on this video. Was this helpful? Was this not? Just sharing a case study of a guy, again, who reached out to me, had this, months of kind of hip, buttock, leg stuff, right? Had no reason why it started. Was told he had bursitis. Shot didn't work. Then was told he had this high hamstring problem, even though he doesn't ever work his hamstrings more than just everyday stuff, right? And now he's going to go down the rabbit hole there. And so I'm trying to keep him. I'm trying to pull him back and say, hey, that's a distractor. You're going to go down that path. It's not going to prove to be very well for you. You're going to get unnecessary interventions. You already had an unnecessary shot. You already had an unnecessary MRI. Is there anything else that you would like that is unnecessary? And of course not, right? So check out the Better Than an MRI DIY diagnostic guide. Hopefully this was helpful to you if you're kind of on the fence about what's going on in your back, butt, hip, leg. Maybe you've been told you have a hamstring problem, and in my experience, it's usually not. All right, especially if you're 66. All right, thanks everyone. Again, this is Dr. Charlie, physical therapist, orthopedic specialist. I help people all around the world with back, butt, and sciatica problems. I teach you how to resolve your own pain. Let me know your thoughts below. Thanks.